Good morning, everyone. Thank you for all the colleagues that have joined online. We just want to give some of the rest of the members another few minutes to join us, and then we'll start promptly at 10:05. There we go. Again, just a warm welcome. Hope everybody's managed to join now and is in the meeting session. Just a quick note in terms of the housekeeping rules for this session. We will keep all of our participants muted during the presentation. And if you have any questions or there is something that you want to ask or just comment on, please use the Q&A platform. After we've completed the presentations from Cornel and Shamli, we will, if there is time, go and have a look at the questions in the Q&A. Alternately, what we'll do is get copies of the questions and make sure that we compile a FAQ document that can be shared with you. Right, then I think we can get started. So this morning we are joined by Cornel and Dr. Shamli Manpot to talk everybody through the launch of the SAHPRA portal. And specifically for this topic, it is important to know this is just going through the functionality for the new Section 21 application process. We are discontinuing the old Section 21 online platform, and it will be replaced then as of 1st of April with the single user interface that basically runs through the engagement portal that all application types will now start running through. So let me hand over to Cornel, and then he can take us through the agenda. And then we can get started with the presentation. Thank you.
Thank you very much, Christelna. Good morning, everyone. My name is Cornel Liebenberg. I'm the solutions architect on the platform, and I will be taking you through some demos of the Section 21 platform to orientate yourself with what is being launched next week, Tuesday. So that will cover Section 21, the engagement portal itself, with the application process, the payment processing. We'll also show you a little bit behind the scenes on how the reviewing process works on SAHPRA side on this single interface, and then also speak to patient outcome reports. And from there, I'll hand over back to Dr. Shamli to just recap on the process. I'll also then touch on registrations, show you the training guides, speak a little bit about support, and then next steps. All right. So in the new portal, you'll be able to make named patient applications, so that's single patient applications, and also multiple patient applications. There's also then patient outcome reports for both of those, and then the ability to do reauthorizations. And the reauthorizations will be on any previously approved application where there's only certain information that you need to update, for example, patient consent and the prescription. All right, so here's a little video, which I'm going to start here, around the application. So once you log in the portal, you can see all your previous applications that's been done, and there are different statuses. There's different numbers. You can search, you can go and view previous applications. From there, you can create a new application. So Section 21, there's new. If you would select reports or reauthorizations, your previous applications will show there. So for category A medicine, named or multiple. And then this is the application form, which you should be fairly familiar with, but in a restructured with the different sections on the left-hand side. There's also several validation that we apply to ensure the data integrity, easy uploading of documents. So you'll note the different stars on the top right-hand side of each field indicates that it's a compulsory field, and it will show red if it's not completed for you to carry on to the next step. Also have on the address, it's a dynamic search box. As you start typing the address, it will appear. You can also add multiple addresses or multiple contacts, and these contacts will also receive the respective notifications from the platform. As you can see there in the top right, there's a little bell at the top where there's in-app notifications in the application itself, and all those notifications also get sent to the respective contacts, yourself as the user that's applying, along with any additional contacts that you add. So we've got a lookup of the license importers, which is on the SAHPRA database, again the address, and any information on the lookups that we do have in the data set, we will then pre-populate. Particulars of the patient. I think I'm going to forward this just a little bit. Go to the next step. So there's the diagnosis. Again, lookup list on the ICD-11 codes can be selected. Different stages. Again, several drop downs to ensure the data integrity. There's some of the instances you can add multi-selects. And again, multiple diagnoses that can be added. Concomitant disease information. In some lookups on that. Then moving along, the informed consent there at the bottom, of which we also made a template available for you to use should you wish. Forward again a bit. So there. Right, on to the next step. So the particulars of the unregistered medicine. There's an API manufacturer lookup. So this module might change a little bit, where we'll have a different search for it, where you can then select off a data set. Recently enhanced. Manufacturer information. Again, a lookup on the SAHPRA list of registered manufacturers. We populate the SNF number. GMP information, and an option if you can't find it on the authorized list, then to actually manually enter the information, just using that found example. And then an upload is also required of the GMP certificate. Formulation information. So this is an interesting module where, as you enter the information, you'll see now, once I get to the pack size and the prescription information, there's the pack size. We're also asking indicative amount. The prescription needs to be uploaded. What I was alluding to earlier is, as you start completing this information on the prescription itself twice daily, and depending on the pack size, you'll see there's some math happening around the authorized packs. So if you were to change the pack size, this is the formula that gets applied to assist in providing how many packs will be authorized for the application, or is being applied for. Other registered countries. And then there's also a lookup on the SAHPRA Medicine Registry for specific reasons. Again, supporting documentation. Second last step. And then the you can upload additional supporting documentation if required. So that's an open field. From there, you then continue to the order. So the platform automatically creates a sales order for you with the correct amount and the relevant details. And that's also important. Let me just pause there. What I have to is that there's a specific payment reference number that needs to be used. All right, so from here, you've done your application. Sorry, I'm just go back to that step that went a bit quick, as I mentioned the reference number. So this is the sales order, and then you need to upload your proof of payment. So that's your EFT proof of payment. We will in the future allow for credit card payments for Section 21, but unfortunately that's not in place as yet. Upload your proof of order, proof of payment. You can just go back and view your application again should you want to. Now we're logging out into a SAHPRA user, so SAHPRA admin user, where they will then be able to go to that payments dashboard for the payment management. They can see any new payments that's been submitted. So that specific application, they can also view the order and the payment, review the proof of payment that's been uploaded, and then either dispute or approve in this case, of which you will then be notified as well, and then the status of your application changes from payment pending to submitted, as you can see there, number 10 at the bottom. And that's in a nutshell the application process. Then moving on to the reviewer. So I'm now logged in as a reviewer, as a SAHPRA user. This is the reviewing step where they can view all the information that has been submitted. On the right-hand side is the review criteria, where they can either make internal comments or comments back to the applicant yourself. And this is now the flow between the different reviewers. So I'm now logged in as reviewer 1. Internal comments as they go through the application and the different review criteria. Add the query on there. And then as it goes through the process, the different reviewers can note the different comments that's been made for internal and external. And then complete their review. This is a summary, make a recommendation, or send comments back to the applicant at that stage, should they want to, which then we'll speak to that process a little bit later. Just cancelling that one. And then the first reviewer submits their review. Logging out now to review a second reviewer. So as it goes through the process, different reviewers gets notified them to review. And then they can pick it up from there and then also see the, do the review criteria from their side. So view the previous comments and then make a final decision to reject or approve. If there's a rejection, there's a reason. Or an approval, then generate the outcome letter, make sure that all the information is correct on there. Final check on that, and then upload it with the correct information and submit it back to you, of where you as the applicant will then again receive the notification that's been approved and have the approval outcome letter, and the status will change to approved, where you can then right click, go view. And this is now, sorry, that went a bit quick. Let me just go back. So from here, just to stop there. So here you can then go into the application to view the approval letter, and then further down the line, I believe within 6 months, outcome report needs to be submitted. So on that application, submit the actual outcome report of the patient. Right. And then the report is saved and submitted to the SAHPRA team. And that is a little bit of insights on behind the scenes, how the reviewing works and how communication will be fed back to you as the applicant. Then I'm going to hand back to Dr. Shamli, maybe just to touch on the process.
Good morning to everyone. Thank you, Cornel. So just to go through the superficial process flow, it's very simplified, but of course there are many micro processes that occur in this process flow. So once we receive the application via the portal, we actually then there's a screening, technical screening that we subject the application to, and Ms. G, if maybe I can have the previous slide, if possible.
Sorry, my slide deck. I'll
Yes.
reshare again.
Yes.
There we go.
Thank you so much. So basically then, once the application is received and the payment is reviewed by SAHPRA, obviously also remember if the application is from public sector institution, there is no payment that is required. So then it undergoes an admin and technical screening, and we then look at, in a nutshell, is the application complete? Is there correct information in there? If not, then we actually then mark the application as pending, and we inform the applicant to complete the application or submit the correct information. And if the application is complete and correct, then we proceed to the next step, which is the review pathway. And here we conduct an abbreviated review based on our internal SOP, and we then recommend the technical screener and initial reviewer then recommend the application for approval or rejection to the unit manager. Then it's recommended to the senior manager, who is the final approver or rejecter of the application, and the outcome letter then is issued by the system. So that, in a nutshell, is basically what our process flow is like, and it's actually built into the new system. Thank you, Cornel.
Thank you. All right. Then just touching on registration. So it is a new platform. Just to date, this was opened up in November last year for pre-registrations. We've got about 206 companies or entities that's registered, with 682 users across those companies or entities. And then maybe just something to note on this. This was more from a health product applications where there were requests where there's individuals with the same email address working across different organizations. So company ABC South Africa and company ABC subsidiary, where the system unfortunately only allows a user to be linked to a single company. Not sure if that will be such a big problem within the Section 21 applications, but that's just something to note of. So if you register as an entity, there's a main admin that registers that can then invite additional organizations. And if that is the case, with multiple accounts is needed, the recommendation is to just speak to the IT department. It is, it's fairly easy to set up an additional alias, still go to your main email address. So in this example, name@domain.com is your primary email address. Setting up extra alias for name.company2@domain.com on your primary account is the recommended solution. So that's a little bit on registrations. Let me show you just on the portal. So it's easy when you land on the portal. That's the default page. You can go create an account. It's individual. There's some additional information that we ask: name, surname, and professional body number. Or as an organization, there's then the different organization types that you can select. So to be aware of what organization, specifically for the public healthcare institution, to ensure that we do the calculation with the order correctly. So there's zero-rated fees tied to that. And then there's 2 or 3 additional steps to go through. So organization information. Yeah, and from there it asks you your personal information, and then just to set your password, and also a verification email that gets sent to activate the user account. Kristalna, was there perhaps anything you wanted to add on registrations?
Colleagues, yeah, I think maybe just a request. We will have the portal basically live then from 1 April. So for anybody that needs to log an application on Tuesday or Wednesday, etc., you will just need to come and register your account. And as Cornel's indicated here, once that account is set up and all of the details and the related documentation has been uploaded, it's there and it's available then for you basically to maintain. So if there is any artifacts like documents or certificates that changes over time, then it is your responsibility just to make sure that you update those and provide then any changed information. But it is something where we do understand setting up the new account might take a little bit of time in the beginning. And if there is any challenges or problems, I think we've spoken about the using the support email address just to reach out and let us know if there are challenges. But yeah, as soon as you can, basically then just to go and get your account set up so that you know that it's ready and available for you to create your first applications when required. Cornel, I think that touches the key points. I don't know if there's anything else.
That's perfect. Thank you, Christina. Then another guide that we put in place, there's training manuals that's available. So it's at the moment we, with the locking down of applications on HPA and the data onboarding for HPA, the portal has been locked down for until Tuesday. But this is the landing page that's available at the moment. If you would like to go and coordinate yourself, if there's applications that you potentially need to do in the next week or so. So that's already available on portal.sahpra.org.za, where you can go and familiarize yourself with the process or anything that needs to be uploaded or documentation requirements, etc. So there is the full quick run through of all the information that's available or what's required for application. There's also a section under getting started for the user registration. So once that goes live on Tuesday morning, have the necessary information at hand to just ease the process. Right, and then on support, so we set up a dedicated, more now technical support, portal.support@sahpra.org.za. And if we can ask you that if in the subject line, depending on what the type of inquiry is, just S21 issue, if there's a problem, something not working or not functioning, or you're struggling with something, and then the description with as much as information as possible in the email itself. And then if there are any new features or feature requests that you would like, happy to hear from you guys around anything that will streamline or make the process easier. And then if there's information lacking or something, a mistake of sorts in the training documentation, happy to also take any queries on that for us to update it or add additional sections which might not be that clear. So that's a request. Thank you. And then, timelines. As we said, so as of the 31st of March, late in the day, we'll redirect the existing platform that you used to. So even if you used to going to the landing page, clicking on the link, it'll direct you to the portal. And then 1st of April is launch. That is everything from my side from a technical overview of the platform. So I will hand back to Dr. Shamri again. Thanks, everyone.
Thank you, Cornel. Welcome to everyone. And so we are looking forward to the rollover of the new system, which is no longer standalone. It's not a standalone system, and there is actually more support in terms of the way the system operates. Next slide, please. So I will be quickly going through the timeline for the rollout. Then during this period, important email addresses for inquiries, and then how to access our key contacts page on our website, and how to actually look at your notifications on the portal and how to access the user manual. A few highlights in terms of what is new on the online portal, and then maybe just a note or two on the application types or scenarios and the processes that must be followed. Next slide, please. So basically, the Section 21 module of the SAHPRA Engagement Portal will go live on the 1st of April. And in terms of this, we have timelines for the rollout of the new portal. So we will process Section 21 applications that are received on the current standalone system until 4:30 today. We endeavor to process them and finalize them by the 31st of March, which is Monday, the coming Monday, and new applications thereafter can be submitted on the new portal, which will go live on the 1st of April. And just to note that this only applies to Category A medicines, Section 21 applications. For veterinary medicines, complementary medicines, and medical devices, you are urged to consult the relevant unit's key contacts page on SAHPRA's website because they might have a different process that they follow. Next slide, please. Okay, so in terms of a Section 21 specific inquiry, if it's about uh, an applicant or an importing company or about a patient's condition or the unregistered medicine itself, please direct your inquiries to Section 21 at sahpra.org.za. Then it's important for you to note as well that there's an email address that you will receive notifications from the new system from. So, and that is notifications@sahpra.org.za. Try not to reply to that email address. It's just a notification from the system, for example, to notify you that you have submitted an application. It's important to then also check your spam and junk mail folder if you haven't received the notification, as you would have received it most likely in that folder. Um, on this note as well, it's very important to verify your email addresses. The moment the system sends you a verification email, please do click on it and verify email addresses. It's important that you do so. How do you access the new portal on the 1st of April? You go to SAHPRA's homepage. On the e-services tab, you navigate down to Section 21 applications, and then there will be a link to the new portal. Next slide, please, Ms. G. Okay. If you're ever lost and you need to contact us and you don't know where to start, you go to SAHPRA's homepage. And then on on the Contact Us tab, you will navigate down to Key Contacts. And once you navigate down the page, you will find it's called I think it's called roundabout arrangement. You'll find Section 21 there and the different units that have Section 21 processes going. So you navigate to Category A medicines, and all of us in the team, we have our contact details listed down there. Next slide, please, Ms. G. Okay, some important, just a few tips here that once you access the new portal, you've registered on the top right-hand corner, you'll find a profile button. Then there in red, I've marked it there. There's a notifications bell icon where you can actually read your particular notifications for your applications. The user manual buttons can also be accessed there, where you see the help button to the left over there. It can also be accessed on your landing page before you log in. There is a help button there, as you can see towards the top right-hand corner. It has a lot of useful information, so please do consult that manual as often as you need to. Next slide, please. Okay, just a few highlights. I'm going to go through this quickly, but let me highlight, let me talk about progress report submission. In previous systems, we didn't have much in terms of submitting a progress reports, but we found that we really need to look at treatment outcomes of unregistered medicines. And we used this opportunity to build in a feature in the new portal where we actually, request, we can receive progress reports for unregistered medicines, and we can then actually, use them for, to look at and evaluate, and then base decision making on that. The other point is that we previously had a scenario where you submit a bulk stock application. Well, now it is termed multiple patient application, and very similar to what Cornel has demonstrated, a named patient application, there is also an option for multiple patient application. And which then takes me to the next point, that you have different scenarios in the guideline where you talk about stock held by the holder of a license issued in terms of Section 22C1B, or an application for state procurement, or an application made in terms of a public health emergency. These must be done via the multiple patient application pathway, and you can then mark it clearly that it is for one of these other scenarios. Then also what we have is we have a multiple patient application payment structure where when you actually mark the quantity or the number of patients that you intend to treat with a multiple patient stock, it will then generate an order for you with the fee for the number of patients that the stock will treat. So that is the payment that needs to be done. So then quick takeaways here is to look at the beneficiary reference that Cornel did allude to on that order page, and that will make it easier for us to actually quickly verify your payment and expedite your application like we usually do. Um, the next slide, please. I think this is the last slide. Yes. Thank you for your attention. And please note that we will be available during this time for answering queries and so on, especially on Monday when the new system is rolled out. Thank you.
Thanks. Thanks, Cornel. Thanks, Shamli. Colleagues, yeah, then I think maybe what we can do, there has been some questions and answers in the Q&A section, but we certainly can just go through some of the questions and see if we have an opportunity to answer a few of these that haven't actually been covered by either Shamli or Cornel during their presentations. So bear with me whilst I just quickly refresh here and then see where we are. Right, so I think the first question from Erhard van Sale, if you apply for a bulk multiple patient application for a potential of 30 patients of an antibiotic, your application fee will be 12,000 Rand for that application. That is correct. So it's a fee per patient application, per named patient application. So I can't remember, Shamli, what the exact fee is as per the new fee gazette. I think it's 400 Rand, if I look
Yes,
at that
that's
calculation.
correct.
Okay,
Correct.
all right.
Yes.
So that is then 400 Rand per named patient application. So it's either a single named patient application or multiple named patient, named patient applications. What is the progress report entail for the applicant? So again, this is something that should be in place, that the outcome reports or progress reports are submitted to SAHPRA for then any approved named patient application, whether that was a single named patient or multiple named patient applications. There is on the system itself, the named patient outcome report template has also been embedded in the system as an online report that then gets filled in. Cornel, I don't think we've got very detailed video on that, but it is in the training documentation.
Yeah, I
Do you
did
want
touch on
to?
that. I did
Yeah.
touch. I can re-show that again. I'm not sure if the question was before or after, but that was part
Oh
of
no,
the end
it was
process.
Yeah, it came in now, but I think maybe what we can do is just if you could kindly just drop in the Q&A for us that link where the guys can actually go and access the training documents, as I saw that question a little bit lower on as well.
Sure.
I think I would then kindly refer you guys just to go and have a look at the training documentation. That provides quite a nice detailed then explanation of what that progress report looks like and what you need to do to get that information back to us within that 6-month period. We are unable to add on users as system states that users already exist. Please advise. So if you have already created an account and you've added a specific user email address to that account, you will receive that message. So you've now asked, please advise how we can have the users deleted. So if I may refer you then just to using the email at the support portal. Oh, portal support. There we go. I got it the wrong way around. That Cornel also shared. And then just indicate for us there it's a S21 issue, and then just specify in the body of the email just that, yeah, there was already a user account set up and which account then needs to be deleted. Let's see, for a Section 21 application being applied for by an applicant, not a healthcare practitioner. So according to the guideline, Shamli, you'll have to correct me here. According to our guideline, the healthcare practitioner, the person that's responsible for the patient treatment, always needs to be part of this process. These two things cannot be disconnected from each other. And therefore, the healthcare practitioner very much is the one that will be driving the application and also making sure that we receive those outcome reports. Shamli, do you want to maybe just reflect on that, please?
Yes, Christelda. So basically, for the purpose of Section 21 applications, the applicant is the healthcare practitioner. So basically, the idea behind that is that the person taking responsibility for prescribing the unregistered medicine then also takes clinical responsibility for the oversight of the patient. And we then actually encourage that the applicant there is the healthcare practitioner. In terms of the fact that maybe a company can apply for a small amount of multiple patient stock, we will be monitoring that amount very, very carefully, because I mean it's unusually large amounts of unregistered medicines that are circulating in South Africa. It's going to be actually monitored. We're actually first going to ask for a rationale behind large amounts of unregistered medicines, and if you can actually then decrease the quantity requested to a more favorable amount, that'll be preferable. But if it is an unusually large, volume of unregistered medicines that you're requesting authorization for, then you're going to have to give us previous usage reports and so on. Thank you.
Thanks, Shamli. Right, and I think then just the confirmation around the switch over. So, Shamli, all applications then you did mention submitted up to this afternoon at 4:30. We will receive them in the alt Section 21 portal, process them, and close off the feedback loops by Monday. And therefore, all new applications we then expect to take in from the 1st of April via the new Section 21 portal.
Yes, that's
Um,
correct.
Perfect, thanks. There's a suggestion from Mornay around would refinement between out of stock reason and clinical need reason for Section 21 create a more efficient system. Shamli, so I did just note in my reply is that this is a good suggestion. Definitely something I think we should just discuss then with the development team also internally and see if it makes sense to add that to the enhancement log. That could be something that we could feedback on.
Yes, definitely. We can discuss this further. We do have a bit of, feature built in there to actually distinguish, between,
The
the
two.
different reasons why
Yeah.
or different reasons why an unregistered medicine is needed. So we can actually enhance that feature.
Yeah, thanks, Shamli. I believe it's part of the drop downs at the moment. So let's see if that needs any other work. Is there not a way to get approval for periods longer than 6 months? Again, Shamli, I don't know if you want to just reflect on that. I think for this one, I just did indicate that Section 21, the special access to unregistered medicines is something that should be viewed as a unique scenario and not a routine application, and therefore also the period of 6 months that's applied in terms of limiting then the amount of unregistered products that's available in South Africa without then impacting patients where there is a specific clinical need. But just ensuring that we support the process that only registered products are available to South African public that has been reviewed and approved by SAHPRA, unless authorized in through Section 21. But it's a special mechanism that then on a use case motivation needs to be approved on its merit by the Section 21 unit. Anything you want to add to that, Shamli, or I've covered it?
You have definitely covered it, and just one more point to add that we haven't issued Section 21s for longer than 6 months periods, and for the reasons that you have actually alluded to, Christelna. The other issue is that if you look at a regular chronic medication script for a registered medicine, it actually is to a maximum of 6 months, and there is actually clinical rationale behind that. So we apply that same principle to Section 21 authorization durations. Thank you.
Thanks, Shamli. Yeah, colleagues, I think also just further to that, we did spend quite a bit of time also looking at and benchmarking other regulatory authorities globally around how they manage their compassionate use programs or their special access programs. And the I think information that is currently being requested, as well as then the process around how we manage the approval of these special use cases is very much now aligned with what we are seeing at TGA in Australia or Health Canada or the UK MHRA and so forth. Right. I think, Shamli, there isn't any change in terms of the estimated turnaround times. Your 3 days is still 3 days. That's correct, yes?
Yes, that is true.
Okay. Right. And then I think in terms of the bulk application, so both you and Cornel have touched on that a little bit. So for multiple patient applications, there is, as Shamli says, one needs to have indication around what the rationale is for that. So obviously based on past treatment data, how many patients, as an example, was for instance seen in a specific oncology practice, and how many of those patients used a particular unregistered medicine, and therefore just looking at their treatment cycles, you are expecting those patients to come in over the next 6 months, and therefore there would already be an understanding around what dose and how many patients you will be treating. So when you apply the dosages and the quantity information inputs, that then informs that calculated approved quantity becomes important. But as the comment in the Q&A made by Cornel indicated, at that stage, the information for the patient is not requested. Only at the time that the patient is then actually treated with the product, and that 6 months outcome report becomes due, will it be important in the submission back to SAHPRA to provide then the patient details. So I think maybe on that again, please do visit the training manuals. Just have a look at what that outcome reports look like and what kind of patient particulars and named patient information would then be required to submit that information at a later stage. Right. Okay, so there's a question. As a hospital pharmacy, we do a lot of emergency multiple requests. Can we open a hospital pharmacy profile with different doctor applications? So it needs to just work the other way around, where each doctor who is the healthcare practitioner needs to have their applicant account. They can then still link the doctor's rooms with their email address as then primary contact, but then add a second contact or a second user, which would then be the pharmacist at the hospital pharmacy, who would actually be the one that helps from an administrative perspective, capture requests on the system, upload outcome reports later on. So I think there is mechanisms that is available to provide this kind of, healthcare practitioner and then the administrative support component that typically a healthcare practitioner would use or have access to, that is responsible then for all of the administrative bits and pieces in the back office, to make sure the applications get logged, notifications are actioned, payments are processed, and of course, in due course, that those outcome reports can then be uploaded and attached. So as long as we have that structure for the healthcare practitioners, where additional email addresses can be added, and a user linked to an practice account for a specific healthcare practitioner or doctor, that does mean that a user with administrative access would be able to then also provide support. But again, just to remember and to stress this, unique email address from a ICT governance perspective. So a unique email address belonging to an account is quite a key thing for us. You will note that if you try and use one email address for various accounts, as per the question earlier on, it will say that the email account already exists and is linked to a specific existing account.
Christina, if I
Right.
can add to that as
Yeah,
well.
please,
Something I
yeah.
touched on was more requirement from HPA. Under the company profile, if you go in there, there is a company email address. So kind of if you put a generic, so in the HPA's example, it is regulatory@pharma company X. So that email address will always be BCC'd into all the communications. If there's a single forwarding address, that is a functionality that you can use if that's a requirement.
Yeah, and it probably would then be easier in those kind of scenarios to create the doctor's practice as the company or the organization, and then add different users to that profile, or then, as Cornel indicates, the actual global email basket, which could then be pharmacy@hospital something something.co.za. Right, recordings, yes. So after the webinar, the colleagues in our communications unit will also then be publishing the recording. So you can certainly go and revisit this and slow the videos down a bit if you want, and just work through this again. It will be on the SAHPRA website under the events section. And when you go to the events calendar for today, you will note then that we have the webinar, and just click on that URL and it will take you then to the right place for accessing the video and the presentations. So the communications unit would do this for us and make this available. Mel, I don't know if you want to say this would be by next week, Monday, Tuesday. Maybe put you under a slight amount of pressure.
Christina, the presentations will be available definitely today. And
Stuff.
Tukozo just needs some time with the video recording.
No
Mel,
problem.
today, close of business, the video will be up as well.
Okay, great stuff.
All right. Okay, so our communications unit will make some magic for us and get this available then by close of business today. So at least on Monday, you will have some time to just then go through the video and the recording. Sorry, the documents. Right, so just a question on current profiles on the old system. Will these need to be reloaded, recreated? Yes, please. That is also why we just stress that point to indicate, please do leave yourself some time to just go through the account creation process before you need to submit your applications. The reason why we are doing this is we have from the old system seen that the data and the data sets are not very clean. It's not very good standardized and normalized data. The way that physical street addresses were spelled, or certain company information, or even just practice information, it made it very challenging for us with the non-standardized, non-normalized data to actually import this and pre-create accounts. So it is unfortunately a process that we will now need to undertake to ensure that the formatting is correct, and that we force the correct information to be populated in the different areas, and then ensure that we also have clean data sets to enable better reporting and better decision making from a SAHPRA perspective. So I think in terms of compulsory fields, just to Cornel's comment early on, please just have a look. See that where there is a heading for a specific section, there is a little asterisk next to that heading if the field is compulsory. So also if you need to upload documents and that is also a compulsory document, then that will also be marked with an asterisk. If there is no asterisk, it's a mandatory field, but where it's compulsory, you need to provide the information or then the related documentation. Right. Section 21 applied to companies that buy only raw materials overseas to manufacture. So for API, if you have an API manufacturing license, there is a process for importing raw materials that is followed with the licensing unit, because the assumption is that you are manufacturing product that is then registered in South Africa with the API or raw material that you are bringing in. I hope I understood the question right. But maybe if you just want to come back on that question and just add perhaps a little bit more detail so that we understand what process you might be referring to.
Christelna, if I may just add there that Section S21 doesn't apply to that scenario that has been
No.
laid
Yeah.
out. It's mostly for named patient use, and we have
Yeah.
over the years
And it's
allowed
finished products.
multiple
So,
patient. Yes, that is true.
yeah. And
Thank you.
always finished product. Yeah.
Yes.
Perfect. Right. And then what if you don't have the patient ID document? So, if you are doing a named patient application, you need to know who the patient is. Otherwise, it can't be a named patient. So that information, please, needs to be collected, and the patient needs to provide a copy of their ID. Usually this is available at the practices, or if not, the practice then just needs to request that from the patient to make sure that can be uploaded. We do verify that a patient exists and he is actually the one being treated by the healthcare practitioner. So it's important for us to have a copy of the ID just to make sure that the patient details actually matches the individual whose ID document is then uploaded. Is there a limit to this webinar? People are claiming they can't enter or it's reached limit. Tukosa, I don't know if you want to comment on that. It's we've got 549 people in, and I think the limit is 1,000. So there's more than enough, how can I say, space in the virtual room. But I think maybe then for colleagues that are struggling to connect, we can then please, if you can just get a message to them to let them know that the video as well as then the materials, the presentations will be available on the SAHPRA website, close of business today. If not, then at least be available by Monday morning. They can then certainly go and revisit the webinar and get all of the details from that.
Yeah,
Right.
certainly. We'll send out a comms later today with the recording and the presentations to everyone that's on the webinar. Thanks.
Right. Great. Sorry. So think just there's, I see now just another follow on in terms of patient ID. So any identification document that will support this is patient so and so and we need to treat patient so and so. So even if it is a passport, yes, that is acceptable. Even if it's a foreign passport, yes, it's acceptable, as long as the proof of identification is provided. Right. I think that covers basically everything. There is probably a bunch of new questions that's come in, but I see we have, and I've already been quite naughty going over the time limit. What I can maybe then just indicate is any questions that we've not had an opportunity to cover then now very, very quickly as we were rushing through some of the Q&A. We'll then take the questions that's been posted on the chat and then also just compile a FAQ document that will be published then next week on the SAHPRA website. So if there's still clarity on a topic, at least you'll be able to just find a response to that particular topic that has been raised in the thread today in the FAQ. And that also will be on the Section 21 unit information area. Great. Then thank you very much for joining this morning's session. We've really exceeded the time. And I just want to thank everybody for taking the time to come and have a look at the Section 21 portal that is then going live next week, Tuesday. Great stuff. Thanks, everyone. Have a good day.
Thank you, everyone.
Thank you, everyone. Bye-bye.